Bye, Cookie.
After a day of teaching her kids at home, Jenny Armstrong sends them off to their dads for the night.
Backpack.
6 weeks into the new reality of COVID-19, she feels the toll on her mental health.
I feel like every day there's coping, and then on some of the most challenging days, there's a moment where it's just a break, and it's almost, I feel like a toddler sometimes.
According to an Angus Reid survey released today, more than half of women between 35 and 54 feel both worried and anxious.
You may be worried about paying a mortgage. Also, maybe you've got kids and you've just got a lot going on. Now, bringing all of that into the home in your new reality just makes it incredibly intense.
Men and women of all ages across Canada are affected. Only a third of those surveyed say they're doing fine both mentally and financially. Almost a quarter of Canadians say their finances are fine, but their mental health has taken a blow. And more than a quarter of Canadians say both their mental health and finances have worsened since COVID-19 hit. Those most likely to be hardest hit live in Alberta, a province that was already economically stressed before coronavirus.
That leads to that mental deterioration and that financial deterioration, and both indeed are part of why we're seeing what we're seeing in Alberta.
But across the country, there's a spike in mental health distress calls.
They're using words like COVID is disintegrating my mental health. Really powerful words and phrases.
The impact of COVID-19 is so serious, Kids Help Phone has started a dedicated support line for adults. But there is hope amid all the worry. 1/3 of Canadians also say they feel something else: grateful. Nicole Ireland, CBC News, Toronto.
Okay, with me now, Dr. David Greatzer of the Centre for Addiction and Mental Health. And Dr. Greatzer, I'm curious to get your take on this. What, if anything, from the findings surprised you? And what is your advice to people who are feeling stressed?
Well, I think that the one thing that jumped out at me was that 14% of people felt normal. In other words, not normal is the new normal. And so advice might be it's okay to feel stressed in stressful times. And many of us are feeling worried. In fact, almost half of us are. And so going back to those things doctors recommend to reduce stress, that's really important right now. Regular exercise, some sort of a routine, and of course, avoiding excessive alcohol and cannabis. Yes, cannabis.
And I remember the last time we spoke, I mean, you mentioned routine. I mean, that is something that in your mind is really important in this case?
Well, it's really difficult to be in a routine, but so important to be in one. Many of us aren't working or we're working from home, and yet that regularity is useful. So maybe getting up at a regular time in the morning, getting dressed, doing those sorts of things might be even more important than usual.
Okay. Hey, Dr. Greatzer, always good to talk to you. Thanks for your time.
Thank you.